welcome to This Explainer. Today, we're bringing Dr. Patrick Dixon's groundbreaking book, AIDS and You, completely to life. We're going to be breaking down the silence, the myths, and that intense social stigma surrounding HIV and AIDS, and we're doing it with clear, structured facts. This is a topic that is just so often misunderstood. So today, we're cutting through all that noise, we're going straight to the source material to see exactly how medicine and humanity intersect.
So, the central question we really have to ask ourselves right out of the gate is this: what actually cures the stigma of HIV? I mean, it's a massive question, right? But as we look at Dr. Dixon's insights today, we'll discover that a combination of accurate medical education and deep, genuine human compassion is the ultimate answer. You just can't have one without the other if you want real change. Okay, let's look at our roadmap. We'll be exploring this dual-lens approach in 4 quick steps: bridging knowledge and empathy, debunking transmission myths, tackling prevention and early detection, and finally moving from stigma to support. Kicking things off with Section 1, bridging knowledge and empathy.
Now, we are definitely not looking at some dry, boring medical textbook here. Dr. Dixon's guide has actually been translated all over the world, including a highly impactful Hindi version called AIDS or OP. What makes his whole approach so revolutionary is that he deliberately frames the clinical realities right within the context of human experience and connection. He figured out early on that just throwing medical data at people doesn't really change society. You have to look at it through a uniquely human lens. You see, Dr. Dixon wrote this book specifically to bridge 2 massive gaps in our society. First up, the gap in accurate medical knowledge. People simply didn't, and honestly often still don't, know the basic facts about the virus. But the second gap, and maybe the much harder one to cross, is the gap in human empathy. Medical knowledge without empathy, well, that just leads to cold clinical isolation. But empathy without medical knowledge leads to well-intentioned yet dangerous ignorance. We absolutely need both. But before we can address those broader social issues, we have to establish a firm medical baseline. HIV, which stands for the human immunodeficiency virus, systematically weakens the immune system over time, and that can ultimately lead to AIDS. Grounding our conversation in this clinical reality is step 1. Moving right along to Section 2, debunking HIV transmission myths. The contrast here between reality and myth is just stark. On one hand, transmission requires very specific fluid exchanges. We're talking primarily about unprotected sexual contact, contaminated needles, or passing from a mother to her child. On the other hand, casual, day-to-day contact is completely safe. No, you do not get it from shaking hands, hugging, sharing meals, or using the same toilets. Yet, these specific myths about casual contact are exactly what wrongly isolate patients and create a culture of total panic. Distinguishing between these 2 realities is just a huge deal. That brings us to Section 3, prevention and early detection. Dr. Dixon lays out these really clear, sequential pillars of prevention to empower everyday people to take control of their health. Step 1 is on the individual and community level, which is basically making safe choices and spreading true awareness. Step 2 operates on a systemic level, ensuring absolute blood transfusion safety and using sterilized medical equipment. And Step 3 brings it right back to you, prioritizing early testing so you actually know your status. These are the actionable real-world tools the book lays out to stop the spread. And that really brings us to a profound truth. While treatment options have obviously advanced a ton since the book was first written, the core fundamental rule remains exactly the same. Early detection and proper medical care completely change a person's life's trajectory. I mean, getting tested early is absolutely life-altering. It's literally the difference between letting the virus dictate your future and you taking control of it through modern medicine. Let's head into our final section, Section 4, moving from stigma to support. The title of the book isn't an accident. The U in AIDS and You is a direct call to action. This isn't just a book about other people or some isolated medical condition. The title itself demands that you, me, all of us take personal responsibility for how society responds to this illness. It places the burden of empathy squarely on our shoulders. Because think about it, if we don't take that responsibility, we fall into a really dangerous cycle of isolation. Look at how this cascades. First, ignorance breeds fear. When people don't know the basic facts we just talked about, they panic. Next, that fear drives societal stigma. People get shunned, isolated, judged. And finally, that very stigma stops people from getting tested or seeking treatment. They're just too afraid of the social consequences to get the medical help they desperately need. We have got to break this chain reaction. So how do we break it? Well, Society must replace judgment and stigma with compassion, care, and support for individuals and their families. That is the true beating heart of Dr. Dixon's work. Our communities have to actively shift from a posture of judgment, which just pushes people into the shadows, to one of unwavering empathy, which brings them out into the light where they can actually get support. To wrap up this explainer, Dr. Dixon's foundational guide proves a really simple yet incredibly powerful equation. Knowledge is the most powerful tool against fear. It reminds us that education and empathy aren't separate concepts at all. They go hand in hand. You learn the facts so you can apply the compassion. Together, they are without a doubt our very best weapons against this disease.
I'm going to leave you with this final thought to chew on. How will you use knowledge to replace fear with empathy in your own community today? I really challenge you to take these insights, the stark realities of transmission, the critical importance of early testing, and that desperate need to break the cycle of stigma, and go make a real difference. Use the U in AIDS and You. Thanks so much for joining me for this explainer, and keep learning.